Welcome to Dentistry Explorer. Today we'll be dealing with the dose calculation of local anesthetic. It is the very important topic regarding the exam point of view as well as daily clinical practices. So we are here to make you easy regarding the dose calculation of local anesthetic. Local anesthesia is a reversible loss of sensation in a circumscribed area of a body caused by a depression of a excitation in a nerve ending or inhibition of conduction process in a peripheral nerves. This is the definition given by Malamed. Here is the classification of local anesthetic based on its composition, and they are: one is ester group, one is amide group, and another one is quinolone. Ester group are metabolized under the liver, and amide group is metabolized in plasma. But we have to keep in mind that some of the example of amide group as well as some of example of ester group such as cocaine, butane, tetracaine, benzocaine should be memorized, as it might be asked in competitive exam as well. Now the composition of local anesthetic, it consists of: one is lignocaine HCl, and another one is major component is vasoconstrictor. Here we have adrenaline as a vasoconstrictor, and it is in a various concentration, that is 1:50,000 to 1:2 lakh concentration. 1:2 lakh concentration means 1 milligram of vasoconstrictor is present in 200 ml, that is 0.02 mg per ml, which we have sodium metabisulfate, which is acting as a prevent the oxidation of vasoconstrictor. And another one is the preservative, which we have methylparaben, and another one is thymol, which is a fungicide, and another component is sodium chloride, which act as isotonic solution for the local anesthetic, and another one is vehicle, which we have modified Ringer solution or distilled water. The concentration of our dental setup, we have 2% lignocaine, and that means in 100 ml of solution we only have 2 gram of lignocaine. 2% lignocaine means 2 gram of lignocaine in 100 ml of solution, and 1 ml of the solution content 2 by 100 gram is equal to 0.02 gram, that is 20 milligram of lignocaine in 1 ml of solution. So here it is very simple calculation. 1 ml of the solution content 2 by 100, which is equal to 0.02 gram, and it is in gram. When we convert in milligram, it becomes 20 milligram of lignocaine. Now we have also think of the concentration of vasoconstrictor. In previous slide we have discussed about the concentration of local anesthetic. Now we are dealing with the concentration of vasoconstrictor dilution. If we have 2% lignocaine with 1:2 lakh concentration, that means 2 lakh ml contain 1 gram of or 1000 milligram of epinephrine. That is 1 ml of the solution contain 1000 by 2 lakh milligram is equal to 0.05 milligram of epinephrine. If the concentration is 1:80,000, then 1 ml contain 0.0125 milligram of epinephrine. Similarly, if the concentration is 1:1 lakh, then 1 ml of the solution contain 0.01 milligram of epinephrine. The maximum recommended dose of local anesthetic is 7 milligram per kg with vasoconstrictor. That is, maximum recommended dose is 500 milligram. Let's suppose we have 80 kg patient which we are going to inject a local anesthetic with vasoconstrictor, what might be the maximum recommended dose for this case? From the above relation, this relation will be helpful for this case, and by the simple calculation, we need 80 into 7 is equal to 560 milligram. But we must have to keep in mind that the whatever will be the calculation, 500 mg will be the maximum limit of a local anesthesia that we can inject. So if it comes greater than 500, please keep the 500 mg as a maximum limit. Local anesthesia maximum recommended dose when it is without vasoconstrictor, it is 4.4 milligram per kg by weight. Here we have, and that it is maximum limit is 300 milligram. If we are giving local anesthetic to a 100 kg patient and who is suffering from certain medical condition where we are avoiding a vasoconstrictor, so the patient we choose a local anesthetic without vasoconstrictor. Dose calculation in this case is equal to 100 into 4.4 is equal to 440 milligram of local anesthesia. But we remember that whatever the calculation comes, maximum limit is 300. So only 300 milligram of local anesthetic can be injected if it is without vasoconstrictor, and in case of it containing vasoconstrictor, we can inject maximum 500 milligram of local anesthesia. Now let's come to the maximum dose of epinephrine per appointment. For a patient with a cardiovascular disease, we can inject maximum 0.04 milligram of epinephrine per appointment, whereas for a normal patient, it should not exceed more than 0.2 milligram of epinephrine per appointment. Now let's revise what we have learned till now. In most of our setting, we have 2% lignocaine with 1:2 lakh concentration of epinephrine. By now, we already know that 2% lignocaine means 20 milligram per ml of lignocaine, and 1:2 lakh concentration of local anesthetic, which means 0.05 milligram per ml of epinephrine is present in this concentration of local anesthetic. So we also know that the maximum recommended dose with epinephrine is equal to 7 milligram per kg, not exceed more than 500 milligram. Without epinephrine, it is 4.4 milligram per kg, not exceeded more than 300 milligram of local anesthetic. Maximum epinephrine in a single appointment for a normal patient is equal to 0.2 milligram per appointment, and for cardiac patient it is 0.04 milligram per appointment. Now let's take one example. We have a patient with no any medical problem, which is 50 kg by weight. Now we have to calculate the amount of local anesthetic that we can inject in milliliter. In our setting, we have 2% lignocaine with 1:2 lakh concentration of epinephrine. In this case, maximum recommended dose should not exceed more than 500 milligram or 25 ml. In this case, we can inject 50 into 7. That is, in this case, we are injecting local anesthetic containing vasoconstrictor. So 50 into 7 is equal to 350 milligram of local anesthetic. But we require relation in milliliter. So 2% lignocaine is equal to 20 milligram per ml of local anesthesia. 350 milligram is equal to 350 by 20 is equal to 17.5 ml of local anesthesia can be injected in this patient. If the patient is of 70 kg, then the maximum dose will be 70 into 7 is equal to 490. For 2% lignocaine, it means 20 milligram per ml of local anesthetic. So 490 ml is equal to 490 by 20 is equal to 24.5 ml of the local anesthetic can be injected in 70 kg patient. At a meanwhile, if a maximum dose comes more than 500 mg, then please keep the 500 as a safest maximum limit of the local anesthetic that can be injected in patient. If we have patient with a cardiac problem, here the dose of the local anesthetic is not limited by the total amount of local anesthetic, but it is limited by the amount of epinephrine present on it. So in a cardiovascular disease patient, maximum amount of a dose of epinephrine we can give is 0.04 mg. If 2% lignocaine of 1:2 lakh concentration, it means 0.05 milligram per ml of epinephrine is present in 1:2 lakh concentration of local anesthetic. Maximum injectable dose is equal to 0.04 by 0.05, that is the concentration of epinephrine in 1:2 lakh concentration is equal to 8 ml, which is nearly about 4 cartridges of local anesthetic. If 2% lignocaine with 1:80,000 concentration, it means 0.0125 mg per ml of epinephrine is present in 1:80,000 concentration of local anesthetic. The maximum injectable dose is always 0.04 mg for a cardiac patient. So maximum injectable dose for 1:80,000 concentration is equal to 0.04 by 0.0125, which is the concentration of epinephrine in this concentration is equal to 3.2 ml of local anesthetic. If the local anesthesia is of 2% lignocaine with 1:1 lakh concentration, it means 0.01 mg per ml of epinephrine is present. So maximum injectable dose is 0.04 mg of epinephrine, which means maximum injectable dose of epinephrine is 0.04 mg is equal to 0.04 by 0.01 is equal to 4 ml. So it is varying according to the concentration of epinephrine in the local anesthetic. If it is 1:2 lakh, then we can only inject 8 ml of local anesthetic. If it is 1:80,000, then we can inject 3.2 ml. If it is 1:1 lakh, then we can inject 4 ml of local anesthetic in a cardiac patient. Now here is one practice question. 2% of a solution with 1:1000 concentration of epinephrine, what will be the maximum dose of local anesthetic in ml that can be injected for 60 kg person? One is normal and another is suffering from cardiovascular problem. So please mention your answer in the comment section and don't forget to subscribe our channel. Thank you for watching this video.